Hi, I'm Mike Hess, Senior Director of Patient Outreach and Education for the COPD Foundation. I've been a respiratory therapist for 15 years and I've learned an awful lot during that time. But 5 things in particular stand out to me that we've learned through the pandemic that are going to help us make our healthcare system stronger and more resilient for the future. Number 1, we've got to stop treating it as a retail business. It's very fashionable to bring in business consultants and try to align all of these principles with the healthcare setting. Sometimes that works okay, but more often than not, especially when we have an unusual situation like a mass casualty event or a public health emergency, we see those principles don't always hold up and can actually stress a lot of the people who are working in an already stressful environment even further. We're very concerned about burnout, and we're very concerned about moral injury, and we're really concerned about a potential shortage of clinicians going forward. That brings me to point number 2. We need to develop more efficient staffing models outside the hospital. Right now, we're facing a severe shortage of primary care providers, particularly after the pandemic, which hit the primary care world very hard. We need to make sure that we're making this specialty, that's really what it is, a specialty, more attractive to new docs coming up through that system. We also need to make sure that we're able to deploy people like respiratory therapists, registered nurses, physical therapists, all of our other allied health folks into these settings so that we can tackle a lot of these problems more efficiently and allow our primary care providers the space they need to take care of the more complex needs of the people we're caring for. Number 3 also kind of goes along with that. We need to develop a stronger public health infrastructure. I was a newly minted Master of Public Health back just before the pandemic, and I thought, wow, this is really our moment to be coming forward. Unfortunately, public health has not been the success we had all hoped it would be during the pandemic, and arguably that has made some aspects of it worse. We need to strengthen our health communications, we need to strengthen our awareness efforts, we need to do all of those things so that we can start heading some of the next pandemic off before it quite gets going. Point number 4 is to remember to listen to the people who are in our care. It's really easy for us in the clinical side of things to sometimes make assumptions about what people need, what people expect, and what's going to work for them. But those assumptions can often lead us into trouble. We need to remember to hear what the people that we're caring for are saying and to respect their autonomy and their desires in order to move forward. One of the easiest ways to do that is through partnering with patient advocacy organizations like the COPD Foundation so that we can get stakeholders at every level, patients, caregivers, the government, payers. We can get all these folks speaking the same language and cooperating with each other instead of making those assumptions. The last thing we need to do is to make sure that we are investing wisely in the future of healthcare. We need to make sure, for example, that our research priorities are aligning well with health impacts of various disease processes. I'll give you an example. COPD is the 4th leading cause of death in the United States, but ranks 176th in research funding. Now that doesn't mean that those other 175 disease states aren't less deserving or less worthy, but we need to make sure that we're using our limited research funds in the way that's going to benefit the most people. We also need to make sure that we're using evidence-based practice instead of just doing things because that's the way we've always done them or because that's what's convenient for us. Again, another example from the COPD world, we have a program called pulmonary rehabilitation that has been well established as one of the best things that you can do if you have a chronic lung condition to make sure you're optimizing your health. But only about 1 in 10 people are able to access these programs for various reasons. We need to make sure that we're prioritizing access to these things that work, and we need to make sure that our clinicians have the tools they need to empower their patients to take care of their own health.